Welcome to Total Physical Therapy's video series. We've got our assistant here today helping demonstrate some kinesiotaping principles. In this taping technique, what we're going to do is we're going to assume that this runner has just recently pulled their piriformis muscle. So they might have a low-grade ache to the buttocks in this region. They might actually have some radiating pain down the back of the leg through the buttock region, possibly down the middle of the back of the thigh. In either case, once we've eliminated out some other factors and pinpointed this issue to the piriformis muscle, we could use a variety of techniques to reduce the tension, one of which is kinesiotape. And if we're going to use kinesiotape to try to decrease muscle tension or decrease the tone of that muscle, what we want to do is we want to apply the tape in a specific direction under a specific tension. The tape itself has some preloaded tension on it, and the tension that is on the tape is near perfect for this technique, so we wouldn't want to apply much more stretch than what we've already had loaded onto the tape. So if you can see, I've already cut this piece of tape almost identical to the length of this muscle, traveling from this point here to the tailbone region over here. And so when we actually lay this tape down, we wouldn't want the tape stretched much further than that, if any at all. The other thing to keep in point with this tape technique is that we want to, again, decrease the tension or the tone in the muscle. So what we'd want to do is we'd want to start from this attachment site here, or the attachment site of the muscle away from the midline. So we're going to apply this tape from the outer aspect of the muscle belly back to its origin, or where it begins, closer to the trunk. So again, as we demonstrated before, we want to take about the last 1/2 to 1 inch of the tape and just peel that paper off. We've lost any of the tension that was preloaded onto this tape, and we want to use that as our anchor to apply right on the outer aspect of the hip, right on an area that's called the trochanter. We're just going to set that adhesive down by rubbing it in. And then the other technique that we're going to try with this tape job is what we call a Y tape job, as opposed to an I taping, which would be a single uniform cut strip of kinesiotape. In this example here, we're going to use 2 tails, and we're going to lie those tails down right along the boundaries of that muscle belly. So we're just going to lie the tape right along the outer aspect of that muscle. On the very last 1/2 to 1 inch of the tape, we want to just lay the tape down with no tension. We'll do the same thing with the other tail. Laying the end down with no tension. Setting the adhesive by rubbing gently. After you've applied the tape, you want to check the range of motion of that joint. Make sure that the tape is not restrictive in any way. And just ask the patient to move with you and let you know if there's any type of restriction. So this is a taping technique to reduce the tension or reduce the tone of an acutely strained, or rather pulled, piriformis muscle.